video,
Okay.
and I record my audio separate. That's the key to good sound. Never use Zoom. Okay, so if you are ready, in 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have a special guest, of course. His name is Jeffrey D. Gross, MD. He is a board-certified and fellowship-trained neurosurgeon with SPINE and ReCELLebrate. As a leader in his industry of neurosurgery and stem cell medicine, he offers specialized precision and concierge treatment options for patients with neck and or back problems, as well as brain and head injuries. Dr. Gross applies conservative, non-surgical, and regenerative stem cell medicine options to first try to avoid surgery. He is an internationally recognized expert in the fields of neurosurgery and regenerative medicine. He has authored numerous book chapters, medical journal articles, and is in the process of completing his first book, Young Again, a practical how to take anti-aging action for anyone. Dr. Gross has written and spoken internationally on regenerative medicine for the spine and anti-aging, and he's been awarded Top Doctor and Best Neurosurgeon awards. And today we are going to talk about stem cells, how they can reverse disease and how they can help us to age better. And with that, welcome, Dr. Gross. How are you today?
Thank you. I'm well. Thank you. Yourself. I'm happy to be here, and I appreciate your reading of the bio, which I listened to that. And it's almost changed a bit. It's morphing so quickly that we probably need to update it because I'm doing so many new and other things on top of that. It's just blossoming.
I love that. So maybe tell us where your work began and how it's evolved.
The short version is I've really embraced regenerative medicine in the last 5 years, and I started to do that to add something for my neurosurgery patients who I was trying to help avoid surgery, to make that the last option and to find other options short of surgery in many cases. And so many people have degenerating joints and discs that I was encountering. And the end game for someone with a painful low back, for example, and a degenerating disc is a pretty big surgery. I kept following the molecular biology and the biochemistry of regenerative medicine and stem cell medicine and said, hey, there's something we can try first. And I'm not the first to do this, but I think I'm at the fringe for putting it to work. But that has now blossomed beyond neurosurgery for me. I'm not only treating brain and spine problems, I'm treating joints and knees and hips and shoulders and metabolic issues and organ issues and inflammatory conditions and all kinds of things that I knew about, but really weren't part of my practice. So now my practice scope seems to be expanding, and I love it. And even anti-aging medicine, this is a real thing.
It's all music to my ears because at 53 years old, I do a lot to stay healthy. Don't get me wrong. But as we all know, there are certain things that just kind of come into play when we age. And some of those, I guess you would say the genetics might actually show up at midlife that maybe weren't seen before.
Well, I think you're right. Some of the genetics, and I will say the epigenetics, the what have you done in those 53 years? What have you been exposed to? How was your nutrition, your diet, your sleep, all of the things that influence what genes are called upon that you've already had.
Yeah, because I can speak for now, how I am now, but I certainly abused my body in my 20s, and I was a smoker, and, I did all the things. I partied. I didn't really care what I ate. And I'm going to say that as a 1970 baby, that a lot of people in this age category probably did the same. And then they're like, okay, what did I do? How do I fix this now?
I couldn't agree more. And a lot of the things that I see, even structurally, like spine and knee and other problems, and even brain issues, Alzheimer's disease and other dementias, have a relation to what I'll call the accumulation of that inflammatory burden in the body. How healthy the gut microbiome had been for so many years. It accumulates. It's for those that are mathematically inclined, it's the area under the curve being time on one end and inflammation, stress in the other.
Exactly. Okay, so your specialty is in stem cells, right? Like, I think a lot of people hear this, and, my husband actually recently did PRP, and even PRP is becoming a little bit more known, but still you get a lot of people who look at you with this blank stare like, huh, what did you get done? So because stem cells are leveling up, right?
I agree completely. I don't think I'd be here if they weren't. So maybe we can define some terms so we're all speaking the same language, and everyone has a primer on regenerative medicine.
Yes.
So with that, there are three main types of what we call regenerative biologics. And this is above and beyond the things one can do for health and lifestyle and nutrition and epigenetic modifications. This is something at the far end of that spectrum, when all of that is not enough to overcome the years of chronic accumulated inflammation. So the first level, the very basic and most simple level, is called PRP, and that stands for platelet-rich plasma. There are other little modifications of it. You can have different types of that, but in essence, that is taking blood from yourself with a professional, drawing a number of tubes. The tubes are put in a centrifuge, and the centrifuge separates the components from the red part of blood from the plasma, which is sort of the liquid of the blood. And in between is a little treasured layer of growth factors. And you can actually stick a pipette and suck out those growth factors, put them together in one tube, and re-inject them into an area of injury, like tennis elbow is classic, or an ankle injury that's not healing. These are usually structural, although they are used in the cosmetic field. You've probably heard of the vampire facial.
Yes.
This is what that is. This is the vampire facial. But you can have vampire anything, really. And those growth factors get concentrated, and this usually takes more than one application. People usually have 3 or 4 applications or more. They're low cost because you bring your own material, you bring your own blood. Usually anywhere from $500 to $800 or so, you can get one of these.
Yep.
And people get packages of them, and they can help. They do help, but it's the simplest, lowest level offering of regenerative medicine. The next level up will be stem cells, and the third level, which I'll get to, are generally called extracellular vesicles or exosomes.
Mm-hmm.
And then I'll explain these, and maybe we can talk about the pros and cons. So the stem cells, these have been around and known about for well over 3 decades. And when I was doing my undergraduate in biochemistry and molecular biology, they were of great interest, but it was too new. We were just learning about them. And after going to medical school and residency and practicing and sort of with the blinders on traditional medicine, a lot of bench research had been done in stem cells, but also clinical research, actually applying stem cell type medicine. However, most of that's in Europe and Asia and other places. So in North America, we've sort of been held back in part by various pressures with economic influences, and I'll leave it at that. Mm-hmm. But we now know that there's enough demand for stem cell type applications. So two types of stem cells, yours and someone else's.
Yes.
So we'll start with yours.
Okay.
So stem cells are usually harvested from the body. It can be taken from the bone marrow or fat tissue, and there's some other sources. And these are called MSCs, or mesenchymal stem cells. Some people pronounce it mesenchymal stem cells. They come from the middle layer of us when we were embryos. And that is usually represents the connective tissue, some of the organs. Most of the body is probably made up of these MSCs or is formed from MSCs. And MSCs can go anywhere in the body and deploy some benefits. They can deploy communication to the local cells. They can activate other stem cells. And they do this through cell-to-cell communication, which we'll come back to.
Okay, I have to ask, when you harvest them, does it hurt?
It was a perfect segue, as if we scripted this. Of course, it's you have to go into the bone marrow, which is a bone needle, right?
Yeah.
So the good news is you supply your own biologics when you do that. There is a process where they're prepared, but when you use your own cells, it's called autologous. It starts with AUTO, auto, meaning your own.
Okay.
So the other word for that is homologous, or of the same. So when they're from you, they're autologous and used for a homologous purpose. So you put them back into the body in a concentrated area where you need them, just like you did for PRP.
Yes.
Now the issue is I'm 57 and my stem cells are 57.
Yes.
So my stem cells are subject to the same partying and chronic accumulated inflammation that my other cells are. And although if you got a bunch of my stem cells together and put them in the right area, they do help. We do have research that shows that. But even better or best, if you've ever had to buy life insurance, you learn that it's not cheap. And had you started it when you were really young, it's a lot cheaper. Well, same thing with the stem cells. If you get the youngest stem cells, they have the most effect. They have the most compounding effect.
Okay, I have to ask you this, because this is really interesting, because I thought of this as soon as I was introduced to you through email. I was thinking about cord blood. So when my daughter was born, we preserved cord blood. And then they said that's not stem cells, or are stem cells within that cord blood?
They are, and I will explain the difference between that process and what I'm speaking to, because I'm speaking to exactly what you're speaking to, but there is a difference, a distinction. Right. So the youngest stem cells have them are the purest. They are not exposed to smoking and partying and environmental toxins and psychological stress and lack of sleep and all the oxidation effects on the body. They are pure, they're young, they're ready to go, they're revved up. Those are the most effective ones. And they can be obtained ethically and safely and clean through a growing number of companies in North America. And these companies have to have compliant labs where they obtain them. And those labs are usually FDA compliant. And I'm saying that specifically because I will disclose that these treatments are not FDA approved. That doesn't mean they're unapproved. And I don't know the Canadian equivalent, but I'm sure there's one, and they probably are run in parallel. But they are obtained from consented and screened mothers who are delivering their own baby through C-section, and what used to be medical waste, we're going to throw away your placenta and your amniotic fluid and your umbilical cord and its cells and the Wharton's jelly within it, which has all kinds of healing factors and growth factors. They save that, they take it, they test it, make sure it doesn't have any diseases, and they make sure it's clean, it's not infected with anything. And those are the biologic stem cell factors that we are able to employ. It's different than if you put away your umbilical cord if you gave birth, because that umbilical cord has very specific markers for your child, that God forbid, if your child ever needed a full body bone marrow transplant,
Yes.
or a blood-borne cancer, a leukemia, something like this, you have that. That is very specific.
For that purpose.
Say that this is not something you would use. There are not enough cells in there to do recurring or repetitive treatments to help a knee problem or something like that. So I want to make sure that distinction is made, because a lot of people ask that because, oh, I heard about umbilical cord, I put some in the freezer. Yeah. Plus, once you thaw that out, it's a one-time deal. You can't freeze it again. So you want to save that for the very rare chance that you need it for something very, very significant.
Okay.
So that's level 2, are the 2 different types of stem cells. Okay. And there's a lot of use of these stem cells. Go ahead.
I have a question. Okay. Let's say you did take my stem cells. Is there a way to test if my stem cells are any good, or if they're going to do anything?
So there are some tests. They're not all standardized yet, and they're basically, you can look at the number of them, like how many per cc or something, and you can look at their activity, and there are tests where you apply them to a certain number of other cells in a petri dish and see the change. Unfortunately, it's not fully figured out yet. We don't have a great activity test for this, and this applies to exosomes too. So the best test is to apply them where you need them and see how you feel or what the response is.
Okay, good to know. So you don't look at my stem cells and go, damn, that girl smoked for 20 years. These are no good, garbage.
Well, we can get into what's called the biological age test, which
I've done that.
Really do look at cellular markers, cellular changes, and circulating antibody changes, depending on the test, that give you a better indicator of cellular damage over time, or the response to that damage. That can apply to stem cells as well. We can do the same test on stem cells. It's a little involved, but it's not impossible.
Very cool. Very cool.
But let me just say this. If your cells have those changes, your stem cells have those changes. They all were exposed to the same partying.
Okay. I get it. Okay. It's not like, these cells were like, oh, we don't get affected by it. Everybody gets affected by the partying.
Yeah. Now, if those cells are, not dividing as much, they may be less affected, and you can look at the telomere length and things like that. But I mean, you're asking high-end questions. This is very good stuff. There are multiple ways to look at it, but sometimes it's academic. And really, if you have an issue and stem cells are used to address that issue or help address that issue, and the issue gets better, it almost doesn't matter. Right. You got the result you're looking for.
Yeah.
Okay. And then that leads us to the third bucket, which is the cell-to-cell communication, which is the exosomes. So stem cells are wonderful. They help divide into other cells we may need to regenerate the liver, or renew the skin in the cosmetic field, or all kinds of anti-inflammatory activities in the body. And if it's not clear, rather synonymous, anti-inflammatory is with anti-aging, because biological age is really how much inflammation we accumulated. But stem cells can't go everywhere. They don't get into the brain and spinal cord because of something called the blood-brain barrier, which keeps them out. Yeah. And although they can have an effect, which we'll get to, because of the cell-to-cell communication. Stem cells also, I guess there's a risk that if you had someone else's stem cells, you might reject them. But luckily, stem cells are called immunomodulatory. They dampen any immune response or rejection response. So I have never heard of one or seen one. I did research it, and I suppose it's not completely impossible, but that's not a worry of mine. Okay. So if we were talking just stem cells, I think the perinatal source are the best for activity and response, not your own. And I think, like you said, your own, they can be painful. You got to harvest them. they're not as functional. They're probably exposed to age and senescence and all kinds of
Yes.
things.
Yes. And I've actually heard a lot about this. Tony Robbins is doing a lot of this stuff. He's doing the placenta, I guess it's the placenta stem cells, something like that.
Yeah, and again, these stem cells from the placenta and the umbilical cord, they have very similar properties. So a lot of the labs where we get the perinatal source, these tissues are mixed together and they separate out the cells. So we're getting some from the umbilical cord and some from the placenta and some from the circulating the amniotic fluid.
Oh, very cool.
But what we're also able to separate now, these labs, is separate from stem cells are the cell-to-cell communication packets called extracellular vesicles. And these are small outpocketing of a cell that forms its own small island, about 1/1000th the size of a cell. And it goes to neighboring cells, and neighboring cells take that in, and that provides information. So it's a way for one cell to tell its neighbors, hey, we're under attack. Change all your gene programming to make these kinds of anti-attack proteins. Or, hey, we're injured, we need to heal. We need to make more cartilage, for example. Let's heal and regenerate. So those signals, stem cells love to give off those signals. Those are the best signals. And those signals are so small, they will cross the blood-brain barrier. They tend to last longer, and they can be even more highly concentrated. So these labs have ultracentrifuges where they spin down and give me what were called the exosomes, or the 50 to 100 nanometer diameter, so the incredibly small particles. And we can just deliver those, and they can activate your own stem cells. They can activate your own cells to regenerate. And they go further, and I can give a bigger dose because of the concentration that I could ever give with a single stem cell dose. So in the last couple of years, I have been more and more enamored with the benefits of using extracellular vesicles or exosomes to assist with the body's healing. We can heal. We have that capability. Sandy, you know, when you had your kids were little, a 3-year-old would skin his knee, when your son would skin his knee, and you know, you cry, you clean it up, put a Band-Aid on it, you go about his way. 3 days later, the Band-Aid comes off in the bath and the scab is almost completely healed.
Yeah.
And you're like, how did you heal so fast?
Yeah.
When we bump our elbow and we have a bruise for 2 weeks, like, how did you?
Yes.
We have that in our genes. It's still there. We're just tapping back into it. I think exosomes are probably the most efficient way to do that.
Now, okay, correct me if I'm wrong, but I see it almost like as we get older and we have, let's say, an old injury, it's like our bodies aren't as efficient at going there and doing the repair and the fix. And so then it's like, you know, we need resources for proper digestion. We need resources for, you know, all these other factors, and just gets harder to send the troops to the old injury. Does that make sense to you?
It's a perfect analogy. And we see these things. Like, I have patients with back pain that when they are eating clean and eating their anti-inflammatory diet and living an anti-inflammatory lifestyle, their back pain is improved. But that may not be enough for everybody. And you're right, our soldiering system, our reparative system loses its steam. It's been injured by chronic inflammation, by toxins, by so many things.
Okay. So what kinds of things do you do? Do you do PRP in your location, or you just don't even do that now?
I don't. I think we can do so much better with a single provision of exosomes instead of 3 times you got to come in for PRP. I got to take your blood, make you anemic for a minute.
Yeah.
It just doesn't make sense. It's great. It's in the right situation, and certain people's who don't do all this regenerative medicine, a lot of orthopedics do PRP in their office. That's great. That's fine. I'm not knocking it.
Yes. Because here's the thing too, where I am, there's limitations. We don't have clinics like yours. Not in my area, not that I know of. I mean, maybe there is, but it's not really talked about. And so, PRP, like I said, from where I am right now, it's like a lot of people still don't even know about PRP. So and I used it for Achilles tendonitis. I had a chronic Achilles tendonitis. My husband has problems with the patella tendon in his knee. So again, old injuries, right? That just didn't go back and didn't heal properly. And so let's talk about application. Let's say I come to ReCELLebrate and what do you treat? Like, okay, I don't really have any major issues, but you did mention something about metabolic health. Like what's that all about? I never even heard of this for using exosomes or stem cells.
Well, we do see clients who come for anti-aging or biohacking purposes. We do see people who come in with, I'm going to call them diseases of age, diseases of degeneration, really diseases of inflammation, type 2 diabetes, low-level kidney failure. These are people who want to avoid going on insulin, or they want to avoid dialysis.
Right.
And it turns out that these regenerative approaches that we're taking do reduce inflammatory burden in the body and can help slow and or help reverse the biological effects of inflammation on the pancreas vis-a-vis type 2 diabetes, the kidneys, and we have examples of this here. I'll disclose, I can't make any claims that these regenerative applications cure or treat a disease or condition, because I want to remain compliant. We fully let everyone know that. We consent people properly. The FDA has not approved nor unapproved these things. They have now classified some of these things as drugs when they're biologics. They're trying to come up with a new path of looking at biologics, but as a physician, I want to do what's best for people. And a lot of things we do, PRP is not FDA approved, just so we're clear. It's we use these things for homologous purposes. We try to put them back in the body to do what they did when we were young.
Okay, so let's say, I just want to understand the process. Let's say if I have issues with type 2 diabetes, I have, like you said, issues with my kidneys, my pancreas, all of that. Like, what do? You just do one injection of exosomes and then poof, you're done? Like, so what's the process?
We start at square one. We get the labs, we do the full workup, we look at the inflammation in the body. We're not going to just treat and try. This is something we do at precision. Everyone's different. And we make sure the person's lifestyle and other controllable factors that could have a role, diet, for example, in the type 2 diabetes, those are all controlled. If those are not effective enough, we can discuss, trying an IV exosome approach to augment the metabolic condition, to augment the healing and to address it. And then we look at the labs and the response thereafter. We look at how someone feels and how their body composition is and things like that. We don't sign people up for multiple ones. Everyone's different. One sometimes is enough to cause the type of regeneration that's needed to keep things under management. I gave someone IV exosomes for low-level kidney failure about going on 2 years ago. And I had in my mind that, okay, that might help for a period of time. Well, it's 2 years. We keep doing BUN and creatinine, which are checking in the blood, how the kidney's functioning. And they improved initially and stayed improved. So is that something we don't need to repeat again? I don't know. We just keep our eye on people, and we don't want to do more than we need. We just want to do enough to get them where they need to get them better. So sometimes one will do it. I notice when I treat a lot of knees now for some reason. As a neurosurgeon, I'm now a neosurgeon. And I use the word surgeon, of course, because I'm a trained surgeon. We're doing a lot less surgery, which is great.
Yeah. Yeah.
But we have been treating a number of knees, and I notice initially people feel a lot of reduced pain because the signal we're giving is highly anti-inflammatory. It reduces inflammation and pain. Some of pain is born of inflammation.
Yeah.
And then that can kind of wear off, but the regeneration may take weeks and months. And I've seen, we've done a couple people who've been game to get an MRI over a year later. We have seen that those people continue to do well as long as the MRI shows some improvement in the cartilage, reduced inflammation in the local bone, improvement in the cartilage. And, I'm collecting these and we hope to publish on them. And we're seeing this in the spine as well. So for discs. So it's very exciting times.
So you're actually seeing in these MRIs some regeneration taking place as opposed to just the reduction in inflammation.
We are seeing improvement in the cartilage height and in how it appears in MRI. I believe that to be regeneration. I have not cut those people up and looked under the microscope to see there's how much cartilage and stuff, but I believe it to be a reduced inflammation and an improved healing of the cartilage. Now think about it for a minute. When we were a developing fetus, we were growing our own cartilage. Let's take a knee. We were growing the meniscus, right? That comes from the local bone. It comes from the top of the lower leg and the bottom of the femur, which is the upper leg. And that the bone marrow they make the cartilage proteins that make that cartilage. So we are delivering the exosomes when we help these people to the local bone through an injection. So not everyone just gets it IV. IV is great for metabolic issues. It's great for autoimmune and other inflammation issues. But when we treat a joint, we want to supercharge cartilage protein production in those cells. We are finding we treat the local bone called the subchondral bone, and it gives more health, and helps the body heal and repair that cartilage. A young person can tear a knee meniscus and it can heal.
Mm-hmm.
But if we have an old, dried out sponge in our knee, over time, it's not going to heal. Well, I think through regenerative medicine, we can help it heal now.
That's unbelievable. So then if you're comparing, again, I'm aware that PRP is kind of like it's not the fancy exosomes, but just because people know PRP better than exosomes, the difference would be PRP kind of takes the inflammation down, maybe sends some of the troops there to help, kind of repair, but it doesn't necessarily go in and help the body perhaps to grow new cartilage or anything like that, right?
There may be some, remnants of some stem cells and maybe even some exosomes in the PRP. So it probably helps
a little bit.
Body some. It's the lowest end of that spectrum.
Okay. And it's hard to say too, because we're all different. I was told that the PRP in my Achilles would only last like 2 years. And it's been 6 since I did it. And my Achilles tendonitis, it still sometimes acts up at the gym, like if I'm doing anything bouncing, but nothing like it used to be. It's just faster to recover, if that makes sense.
Yeah.
Yeah.
No, you reversed that injury through PRP and rehabilitation, right? And probably other good nutrition supplements and things like that.
Okay. So back to the exosomes, the application is different, meaning it depends on what you're treating. So sometimes it might be whole body IV, sometimes it might be localized. And I have to ask, is this affordable for people? Because it's not, and cost is always going to be a factor. But for me, I have a budget for my health. Like I think we all should. That's my opinion as a nutritionist and a practitioner, is everyone should forego the $5 a day Starbucks habit and put that in a bucket for your health, right? So, I know the costs are probably going to be different depending on what it's for, but are we talking astronomical?
We're not actually, we've tried to keep, I want to make this available. I'm trying to get the word out that this is a thing, and not everyone needs to jump to knee replacement if they have what's called degenerative joint disease, which is kind of a summary phrase, but it's not a great thing to say. People have heard the phrase bone on bone or osteoarthritis, or my
Yes.
doctor said I have arthritis, I need a knee replacement. Not everyone needs. Listen, there's a great study with a 15-year follow-up out of France, published a year or two ago. They've been doing this a long time, and they have confirmed that people who need knee replacements can be salvaged. They've done that through stem cells. I'm not even using exosomes. So if we can do it with stem cells, I imagine we can do it with exosomes. We're seeing that in my own experience. But it's not. A single knee is usually with 2 doses of exosomes. We do these types of bone injections at a surgery center under some local anesthetic and sedation, not general anesthesia. So there are costs involved with the facility, a little sedation from the anesthesiologist, and the 2 doses. A 2-dose knee is somewhere between 8 and 10,000 US. You won't pay less going out of the country, out of the US for that, because there are a lot of places in Central America who do this kind of stuff, and it's not a bad price. The IV, that's kind of our, welcome to regenerative medicine. That's a lower end. In the office, we can do that for just under 4,000.
Okay.
The biggest expense is the product. I have to buy the product. It comes shipped on dry ice. It goes into a -30 special freezer that I have, and I buy those usually 10 at a time. And they're not inexpensive. It's I pay just under $2,000 per dose. So really, most of the cost of the procedure is product I have to buy ahead of time, or surgery center cost.
Okay, so here's a question for you. I've done the biological age test. I've done that with True Diagnostic. And what if somebody knows, like, so my telomere length is that of a 38-year-old when I did it. My immune system is that of a 32-year-old. So if somebody has already done this kind of testing and says, hey, Dr. Gross, can we use my own? Do you do that?
I don't. A lot of people do. It's use your own stem cells is what you're asking.
Yeah.
It's a hassle, right? I have to harvest from the bone marrow. So that's a procedure. And then redeliver, which I can. The exosomes are, again, so much more efficient. There's no harvesting. I can give a higher concentrated dose than I can from a harvest. I couldn't harvest enough stem cells. Plus, I don't want to take your 32-year-old stem cells when I can get fresh stem cells from the perinatal source. Not that there's anything wrong with 32-year-old stem cells, but why are we going backwards?
Okay, that makes sense. And you want to do something that you have seen more of a track record that you can pretty much say, you're going to have better luck with this than your own.
I can tell people my experience. I'm not, because of the FDA status, I'm not allowed to say that everyone will get the same experience that someone else had. It's like an investment, right? Past performance doesn't guarantee future results, but right. I'm very excited by this. And the cost of these procedures, I think, should be weighed against the cost of a knee replacement and the disability and the lost work and the pain and suffering related to that, and the sedentary features that go with it, and the metabolic problems that go with being sedentary, et cetera. The downstream costs, these really aren't super expensive. A lot of people use what are called HSA accounts, which are health insurance accounts that they can set aside some of the money for their own purposes, without having to deal with all the crazy regulations that the health insurers do to limit what they'll cover, because they won't cover this. It's not FDA approved.
That makes sense. And once you do the procedure, so for me, specifically, it took about 6 months before I really saw that. And again, we're talking about PRP, not exosomes or stem cells, but that's the only thing I can personally relate to.
Right.
Took about 6 months before I really was like, oh crap, I think it worked. Because I went through periods where I was like, oh no, I don't think it worked, because it took time. But for something like exosomes, is there like a little period of time where you just kind of have to wait and see before you see positive results?
We have what's called a bimodal response. There's an initial response that is related to the reduced inflammation. And then there's a second response that is the regeneration response. And that takes longer and it's progressive. So both can occur where we see some initial reduction in pain, improvement in function, and then over time, the regeneration, depending on how bad the cartilage is, how bad the issue is, how healthy, the environment of the body is. Is it a healthy person? What's their diet? What's their epigenetic lifestyle like? Diet, exercise, nutrition, sleep, breathing, everything. So it just depends. Yeah, it depends, which I know is a great answer that many doctors give. But I would say that most people with moderate, degeneration of a joint should see improvement initially from the anti-inflammatory effect. And then if that wears off, usually within 3 to 6 months, they have a measurable clinical benefit.
Have you ever had any patients come in that, let's say they have really bad fatty liver? And because we all know that the liver is one of those organs that can regenerate. You just have to change your lifestyle. But let's say you got somebody who's like, no, I want to enjoy life. I want to be an age rebel. I want to have a little bit of fun.
Yeah.
But I also I don't want all the diseases that are associated with aging. So do you ever have patients like that who come in and say, just give me a whole workup, doc?
Yeah, we can do it top to bottom. We go over someone's, I used to do brain surgery and now I'm doing, let's talk about your vitamins and your supplements and your probiotics and your microbiome and your biological age tests and how you sleep. Are you doing breathing exercises? I'm doing I've started to really get involved in the biohacking circles and found my people. So we do it top to bottom. We call it the anti-aging medicine. We call it precision because we do it precisely individualized for each person based on that person's body and cells and exposures and experience
and goals, right?
And that's very important. Yeah, this isn't just about what people's medical needs are. It's about their desires. Like you said, how long do you want to live? How do you want to be able to feel when you're 90? Not, just living to a number. You want a healthy longevity, a health span, not just a lifespan.
Okay, you mentioned knees. What about hips? Because hip replacements seem to be a big thing, even for people in their 50s, like younger than knees.
We see not as many hips, just by the nature of how we abuse ourselves athletically and otherwise. Knees tend to go first, but we have hip patients. It's the same process. I use knee as an example because there's so many, and because the French literature has that wonderful 15-year follow-up paper with success in salvaging people who needed knee replacements to becoming people who did not. So I think that's huge. If we can save people from having these surgeries when they absolutely don't need them, or we can put them off for a few decades and make someone functional and enjoy their grandkids or activities and what have you. Hips, knees, we treated ankles. I do plenty of shoulders. I've got a collection of athletes that have shoulder abuse, and we treat their shoulders. I've treated other joints as well.
My son actually just had pretty extensive shoulder surgery 4 weeks ago, and the only option that we had in order for him to play varsity baseball again in September was get that surgery done. So, and this is 6 weeks in a sling and a lot of pain. and recovery and titanium screws and sutures and all kinds of things. I've watched it. It's not pretty. So, and he's only 21.
Yeah.
So think about going through that if you're 50, 60, 70, right? It's way harder to recover.
It's harder to recover. The tissues aren't as healthy, because of the accumulated inflammaging in the tissues. There's a role for surgery. It's not going to go away, but if we can cut it way back by helping people heal through these means, great. I think that's a service.
Okay, summarize to me, for me, some of the conditions. Okay, we talked about knees, we talked about hips, we talked about the pancreas, we talked about, what else did we talk about? Like, what if you do the once over as well? Like, it's just like a general IV for aging better. Like, that's an IV, so that just kind of goes everywhere and just takes the inflammation down everywhere.
It does. And, we have patients that come in for that just want to do it preventatively or biohacking style. I do it.
You do? What do you do? Tell us.
I've had the IV. I probably do it 4 times a year on average. It gives me energy. I sleep better. I'm pretty good cognitively, but I think I'm clearer after closer to a course of IV exosomes. I have a couple little aches and pains from things, and it does kind of quell those for a few months at a time. And I can tell I travel a bit on the airplane back and forth between my offices in Nevada and California. And if I sit a certain way, my knee does get a little stiff and cranky. But for many weeks after exosomes, I don't feel that. So I know it's doing something. I have people come in with trying to recover from heart attack and stroke. Exosomes will get to your brain. They will get to your heart. We have people with dementia that come in. There's a growing body of literature on applying exosomes to help reduce inflammation and improve the response. I mean, there's also a body of literature with stem cells, but again, stem cells carry with them exosomes, or they're making exosomes. So I feel that the exosomes are giving the same signal. We can just give them more concentrated. So IV is a big one. We do plenty of that.
Yeah, that makes sense because too, I actually recently interviewed Dr. Dale Bredesen, the Alzheimer's.
Yes.
He and a big part of his research shows that if you could take down that inflammation in the body, that's a big part of Alzheimer's people.
Yep.
So, I mean, that interview hasn't come out yet, but Alzheimer's ain't really what it seems. Oh, what about people who have had head injuries like concussions and that sort of thing?
Yeah, so this is the more apt term now is traumatic brain injury. There is great literature on this. We do see some people for this purpose IV. I even have a few spinal cord injury patients. We haven't been able to return movement in the legs, for example, but we are noticing some of them who have what's called neuropathic pain, which is pain from injury to the spinal cord. There's an inflammatory component. So the exosomes have been helpful in reducing the need for pain medications for neuropathic pain.
Okay. And, what I always find interesting is you mentioned rejection. So when there are organ transplants, I actually know somebody who had a kidney transplant and it was rejected. Do you think that the future of medicine might kind of progress to helping with organs that we've transplanted in the past, like kidneys, lungs?
Listen, without a doubt, we are just scratching the surface, Sandy, on what's available. There will be in the future designer exosomes for things like this. There will be manipulated, it's not allowed now, but manipulated stem cells, that we can induce backwards using factors are called Yamanaka factors back towards the type of cell that's even before a stem cell, which is a pluripotent stem cell, or if you want to look it up on the internet, it's iPSC. And these can then be redirected into certain functions to address cancer, to address, how to manipulate the immune system so you can let someone else's kidney live in you. Maybe we won't need a match down the line. We can learn how to make that match part of our own immune systems by certain exposures. And this is just regenerative medicine. I mean, we've got rapamycin and rapalogs and other things that help modulate immunity, improve stem cell function, and this is being looked at, right? These are available. This is really high-end biohacking.
Yeah, it's fascinating. I find it fascinating because there's just so many things coming out just to help us age better, right?
Yeah,
right. I don't know if you've ever heard of her, Liz Farish?
Yes, I have.
Okay. She did something quite a few years ago. Like she was like probably one of the first I had ever heard of. Was it stem cells that she did?
I follow her on LinkedIn, and I know
Yeah.
she's in the regenerative medicine industry space, but I don't know exactly what's happening.
Yeah, I just know she was one of the first. And, this brings me to risks. Are there any risks in doing any of this?
Everything has risks, right? This is the medical field, and we don't hide from them. We discuss them. So there's always a risk of an injection, bleeding, infection, nerve injury from the needle, things like that. Yeah. There is a risk that these products carry some kind of genetic material, or and exosomes, by the way, have no DNA. Stem cells do. So there is RNA, but no DNA. So that we're carrying something, or a hidden infection we don't know about, even though they're screened. I always talk about that. I haven't seen it, but it would be fair of me to talk about it. There's a risk that things won't work. We don't give these treatments to anybody who's on blood thinners, taking anti-inflammatories, or has cancer that hasn't been in remission. Why? I don't know how it'll affect cancer patients. Blood thinning is easy. We don't want anyone bleeding. These are things that, and anti-inflammatories work against these things. This is a very interesting question. Many people ask, Sandy, I'll ask it because I'm sure one of your listeners will be interested. If aging is inflammation, why don't we just take Advil? Why don't we just take anti-inflammatories? Why don't we just take those? Because they only shut off one path of inflammation in our bodies. Our cells have all these different pathways, and they have parallel pathways. There are many ways. Like if you look at your Google Maps, like I want directions to this place I'm going to, and it gives you options. Which option do you want to take? There are multiple paths. Our cells have that too. Shutting off one of those paths, like a COX-2 inhibitor, for example, doesn't shut all of them other ones off. And one thing about biochemistry is if you shut down one system, the other systems work harder. So you shut down this road, many other people take this path. So anti-inflammatory medicines typically do not work in an anti-aging sense. Then some people say, why don't you use steroids, right? Steroids are anti-inflammatory. If you have an asthma attack, you get an IV steroids so you can breathe again, right? That's necessary. But those corticosteroids accelerate degeneration in joints. So even though they're helpful when you're in acute pain, chronic repetitive steroid injections are actually not good for joints. They help degenerate joints. So we don't want that either. So globally saying aging is inflammation might be a little oversimplified. And that's why when regenerative medicine changes all the pathways, when you give an exosome, it goes in, tells that cell, okay, I need you to be in healing mode. I need you to be in antioxidant, anti-inflammatory, DNA repair mode. And then we're going to heal this thing. That's the goal.
Okay. You mentioned that stem cells carry DNA.
Cells carry DNA. Most cells carry DNA.
So
stem cells do.
And exosomes don't?
They do not generally carry DNA. You could probably have a few fragments of DNA, but generally exosomes are packaged with growth factors and peptides. We were talking about peptides before we went on the air. And really, we're giving those peptides. If you take them for therapeutic purposes, we're giving those peptides just the way an exosome would, right? So those peptides go into the cell and affect what genes are being active or transposed or utilized. So exosomes carry growth factors, they carry peptides, they carry microRNAs. These microRNAs have largely been characterized, and some of them have numbers, they, mRNA, 123 or whatever. And these are basically like peptides. They're known fragments of RNA that produce the same healing and regenerative growth factors. So the cool thing about exosomes are one cell can tell another cell what to do, including make more of these exosomes. So it starts this cascade of, hey, I'm giving you this important signal, tell your neighbors.
Very cool. Now, because so many people, they've heard RNA, mRNA, DNA, all of that. Can you just do a very quick explanation? Because, people know the mRNA vaccine, they know, so just, if you could just explain those two, that would be great.
Sure. Listen, in the nucleus of our cells, we have DNA. Those are our genes and our chromosomes. That's the information that our body uses to make proteins. And the proteins are enzymes, or they're structural, or they make cartilage, or they help your liver function, or they make the body functions on these proteins. Okay. Now, when a gene is activated and made available, you have little organelles that come in and they'll make a copy. It's like a photo, old mimeograph copy. They're spitting out these copies, and these copies are made using RNA. And it's very similar to DNA, but it's basically the copy paper. And that copy paper leaves the nucleus of the cell with that information, gets into the cytoplasm, or the big part of the cell, and that copy is used to make the protein using a ribosome, which is how it's done. And those RNAs are throughout our body. We would be dead without RNA. Now, a small fragment of RNA is called a microRNA. It's just by classification. It's like, do you have a 1-bedroom studio or a 3-bedroom house? It's a small piece. It's a microRNA. Now, recent biotechnology has allowed the use and leverage of microRNAs to create vaccines. The microRNAs, for example, can be given to a body. The body takes in those RNAs, and the copies are floating around, and they start to make the proteins that those RNAs code for. It's not changing your genes, right? Your genes are DNA, and those RNAs then start to make proteins. For example, a viral protein that can then let your body make antibodies. So that's how the vaccine might work. You're making antibodies against a protein. That protein was told to be made by a copy of RNA you were given.
Okay. I think I got it. I remember that in back in college when I went back in my 40s, and I like to explain that because, and you explained it very, very well, because I think people need to understand at least high level, just the basics of it. So, is there anything that we didn't cover off? We're almost at an hour. I want to make sure that you get everything in.
There's no way we could get everything in. This is a great conversation. We probably opened up, 10 potential ways of talking about other things, but I want people to know regenerative medicine is a thing. It's here. Hopefully the regulatory and the health insurance piece will catch up with it. But in the meantime, there are ways that you can address problems. There are ways to avoid surgery. Not for everyone, but let's try. It's here, it's available. You don't have to travel to Central America or Asia or Europe. You can, it's a great places to visit, but it's available.
Okay, so you look pretty young, I would say. So if I was to come in every year for an IV, would that make me age better in my skin? Would that help?
Well, we really didn't get too far into cosmetics, but if you—
No, we didn't.
The Exosomes IV will get to your dermis, the cells under your skin. And should have anti-inflammatory benefits and health benefits, biologically and theoretically. Have I measured that? No. Are there other ways? Yes. We talked about the PRP vampire facial. We have had some clients who have microneedling, and then we can topically apply the exosomes. A lot of places have that available. A lot of cosmetic clinics.
Yes.
So that and they have before and after pictures you can look at, and they're seeing a more youthful and radiant skin. You know, and I do have colleagues in that space. You may know Rachel Varga and others who work on that. So that's a coming thing. There are other applications instead of fillers or mixed with fillers. I've seen online injecting some, you know, some people who lose muscle mass in the fingers. They can have injections of a combination of filler to fill the space temporarily and exosomes. So when the filler goes away, hopefully the exosomes are regenerating, you know, some of the tissue, which makes me want to mention, you know, one thing we know about longevity is it's correlated with good bone density. And I know you've done a piece on osteoporosis.
Yes.
And good muscle mass. And these things require the right hormones, the right health, the right vitamins, weight-bearing exercise. But to support these things, we also know that exosomes can support the bone marrow. There are research papers out, you can Google about bone density and use of exosomes, that exosomes support bone density and muscle mass. And if you have your muscle mass and your bone density, you're not going to become frail. You're not going to, you'll have health span, not just lifespan. And that's, there are some wonderful papers on that.
Oh, very cool. I mean, that's a very interesting piece in and of itself, because frailty, you know, you hear one thing, don't eat meat, mTOR, turning it on, turning it off. And it gets so complicated. And honestly, I'm always of the mindset that balance is everything, right? So don't turn everything off here in order to get this, or you could mess something up here. Like, it's all about balance. Right? So I love that you mentioned that, because you see some people who are trying so desperately to live like, you know, the blue zones, but then you look at the blue zones and it's like they might live to 100, but they look old and frail.
Yeah.
Right?
Yeah. No, you're 100% right. We're supposed to go out in the sun and get sun exposure, but we also don't want to get skin cancer and wrinkled skin. So yeah, there is balance. 100%. We see that biochemically in the cell pathways. You know, one pathway is up, the other one's down. There's a compensatory pathway, and it stimulates this and inhibits. Yeah, we have that. If you ever look at a biochemical chart, it's all over the place. It's a crazy wiring diagram. But you're 100% right. I think we respond to hormesis, which is slight stresses to make us more resilient, like intermittent fasting or short fasts for a few days. You know, heat exposure, saunas, cold exposure. These stimulate our body to release survival proteins, and those make us more youthful because they are anti-inflammatory. Yeah. And I think you're right that diet, the blue zones are really about diet and, you know, organic and natural. That's probably the biggest component.
Okay. So can you treat patients from anywhere in the world? They fly in, they see you, they don't have to be American?
No, you know, we don't discriminate. So I do a lot of the initial work by Zoom, because we want people to have all the right tests. I don't want someone to fly here and then, okay, you're not a candidate or we can't do it, right? We want to do it initially. So I do a lot of Zoom work these days. We order the right tests, but you know, a lot of people don't mind coming to visit Las Vegas or California. So we're in hopefully reasonable destinations.
Yeah, you're in a good spot for sure. Okay. And I guess the only people who may not be candidates are people who have some health conditions that are pretty serious, like active cancer or things like that you just have to tread lightly a little bit more.
Yeah, I don't want to make a cancer worse.
Right.
So we just don't have enough information on that. If someone has a bleeding problem, I can't deliver the treatment. And then there might be other reasons, if someone is going to have a horrible lifestyle and diet, and it doesn't make sense. Why would we, if you're flying an airplane, why would you put the engines in reverse thrust midair? You just wouldn't do it. So it just wouldn't work.
All right. Okay. Where can we find you? Where are your offices?
So Henderson, Nevada, which is a suburb of Las Vegas, and
Okay.
Newport Beach, California. It's best to find us on the web or social channels, or maybe in your show notes if you don't mind. We're ReCELLebrate, ReCELLebrate. You can email or direct message us on any of the platforms, and we'll be happy to get back to you and hopefully meet. I'd love to meet new people. So you can reach out on LinkedIn or whatever, just find us.
That sounds great. Thank you so much for your time today. I loved our chat.
Thank you very much. It was wonderful meeting you.
Okay, I hit stop. Let me just, oh my gosh, I had to really refrain from sneezing. That was not easy. Hang on.
Wow, we covered a lot, and I love that you got right into the meaty topics. That was fantastic. Thank you.
Well, you know what? I think the meaty topics are what everybody wants to hear about, right?
Right.